Kidney stones can be caused by a lot of different things, but the main ones that we need to know are calcium and phosphate. Both of them can cause kidney stones. So some assessment findings that you might see in a patient when you're doing your head-to-toe assessment on a patient with a kidney stone is colicky pain. So that's kind of waves of pain as the ureters are trying to push that kidney stone down through from the kidney into the bladder. That pain is usually at the costovertebral angle, which is just the angle around the small of the back where the kidney is. Some other things you might see are dysuria, so pain on urination, difficulty urinating. You might see pink, red, or brown urine. That's because sometimes when the kidney stone comes down, it causes damage to the ureters, which can bleed and then can come out into the urine. Mainly the reason why it causes damage is because it's something called a staghorn. So you've got either round or staghorn type kidney stones. So the round is a lot less painful for these patients because it doesn't scrape as much. But then the staghorn can scrape across the ureters and damage the bladder as well. Some other things that it can cause is frequency urinating. They just feel the urge to urinate all the time, even though they don't really have as much urine as they expect. If there's an infection, which can be caused if that staghorn, again, scrapes across and then introduces bacteria into different places along the GI tract, or sorry, the GU tract, you might see fever and chills along with that infection. So some procedures that we might expect to see the doctor to order is lithotripsy, which is just sound waves that they go through. They aim exactly at where the kidney stone is, and then the sound waves break up the kidney stone so it's easier for the patient to pass it. Ureteroscope, so that goes up through the urethra and then into wherever the kidney stone is, and it goes and breaks it apart. So again, it's easier to pass that stone. This one's just a little more invasive than lithotripsy, just depending on what your patients, if they don't qualify for lithotripsy. You've got a nephrolithotomy, so they go through the skin and the small of the back into the kidney or wherever the kidney stone is, and they actually remove it from there. Usually the only reason they would do this is if the kidney stone is huge and if they break it up, it's still gonna be too big to pass, or there's just gonna be lots of stones that they would have to pass along with it. The reason that we would do a parathyroidectomy is the parathyroid is responsible for calcium regulation in the blood. If we've got too low of calcium, then the parathyroid hormone stimulates the bone reabsorption to cause the calcium level to increase. Sometimes we can get tumors on those parathyroid glands, and that can cause too much of an increase in calcium levels. So we might take out the parathyroid to avoid that being the cause of your kidney stones. Some medications that the doctor might order, the first one is calcium supplements. Lots of people don't understand why we would order calcium supplements if we've got too high of calcium. The reason is if we've got low calcium in the blood, then the parathyroid is going to stimulate the bone to reabsorb, and that causes an increase in calcium levels. So if we've got plenty of calcium in our diet, then we can avoid that bone reabsorption and consequently accidentally maybe overcompensating for that low calcium levels. Alpha blockers, they cause the ureters to relax, and so it makes it easier for that stone to pass through and not quite as painful. Some different complications that we're worried about with somebody with a kidney stone is hydronephritis. So that's when the kidney stone gets blocked or gets stuck in the ureter. And so the kidney is still making all of this urine, but it's just getting backed up in the kidney and behind wherever the stone is stuck. Also pyelonephritis, if it's especially a staghorn type of kidney stone, it can cause breaks in the kidney or in the ureters, and then that can cause an infection, which is pyelonephritis when it's that far up in the GU tract. Also could cause cystitis. Again, the bladder may just be irritated because of that weirdly shaped kidney stone in it banging around in there. So some different labs that we might expect to see are calcium levels. We want to see if maybe the parathyroid is responsible for your kidney stones. You might see a DEXA scan just to make sure that the parathyroid hormone isn't causing too much of a reabsorption of your bones. so that we're not causing osteoporosis as well, which is just pretty much just basically hollow bones. You might see a KUB, which is just abbreviation for kidney, ureter, and bladder. That's an x-ray of just that area, and that would show really brightly where that kidney stone is. A urine analysis, that lots of times we just strain the urine, and then that can show an increase in red blood cells or white blood cells if we've got an infection as well. You might see a CT scan that would show, that's an exam showing the soft tissue. And so that's where we can see a kidney stone as well. An IV pyelography or an ultrasound are just some other different ways that we can look at a kidney stone. So when your patient has chronic kidney stones, they keep on having kidney stones over and over, we need to teach them some certain things to avoid or to do in order to avoid recurring kidney stones, or also are called urinary calculi. So first, we need to teach them to drink at least 3,000 milliliters of fluid a day. We need to teach them to eat vitamin C, take calcium supplements. We need to teach them to either avoid Coca-Cola or dairy products, or like soda or dairy products, because those have phosphate in them. And if they do decide to drink them, teach them that they need to drink an equal amount of water. There's lots of foods that are kind of contraindicated with patients who've got recurring kidney stones, so teach them that if they decide to eat those foods anyways, then they need to increase their fluid intake for the next couple of days.